In this presentation, you will learn what predictive analytics is and what it is not. This video will also highlight a real-world application of predictive analytics in healthcare. Broadly defined, predictive analytics comprises a variety of techniques that predict future outcomes based on historical and current data. This is accomplished by uncovering patterns and capturing relationships in the data. However, more criteria is needed to truly capture a definition for predictive analytics. No definition of predictive analytics is complete without including big data's role. Vast amounts of data are required when utilizing predictive analytics. In fact, the concept of big data is so intricately tied to predictive analytics that some people classify the two terms together. While this definition may be sufficient for some business sectors, a more detailed definition of predictive analytics is required for healthcare due to the sensitive and critical nature of the data. Although a large amount of data is generated through healthcare, it pales in comparison with the amount of consumer-driven data generated for an individual. The complexity of healthcare doesn't allow for every medical condition to be predicted. Therefore, it is of utmost importance that researchers carefully choose which topics they are interested in predicting. Healthcare ethics also dictate that outcomes from predictive analytics which clearly benefit the patient need to be appropriately applied. Because healthcare utilizes this predicted data in a patient's plan of care, some find the term prescriptive analytics to be more appropriate in the field of healthcare. Now that we have defined predictive analytics, let's look at a real-world example of how it can be applied. In this example, we will consider how claims data from an emergency room can help predict hospital readmissions. Machine learning can be utilized to generate an algorithm which would show the top 3 traits shared by patients who are readmitted to the hospital within 30 days of their initial discharge. Electronic health records can be mined using this criteria to generate a list of patients at high risk for readmission. If we take this example a step further, an RN visit can be scheduled within a week of discharge for these patients who are at high risk for readmission. This applies the concept of prescriptive analytics to our example. Hopefully, this video has provided you with a better understanding of predictive analytics and its use in healthcare.